We go to, of course, the Sierra Leone Association of Social Workers. They still continue for commemorate the Mental Health Day prevalence, of drug abuse. So we got somebody by the name of Umu L.K. Jalloh. Good morning.
Yeah, good morning, sir. Good morning, Sierra Leone.
Yes. Now for no bell the micro, now for chocolate.
Good morning, Sierra Leone. Good morning.
Yes, because say we get a lot of drug abuse issues at this, and when we talk about mental health, quickly, just remind people when we talk about mental health, what do we mean?
Yeah, so most of the time when people hear mental health, they get this idea as for person with craze or person with get sickness na in brain. But mental health, they talk about the health of how we they think and the health of how we they think development-wise. Because if we look at all waiting, they don't mention about development, different people they don't talk. The major thing they talk about is behavioral attitudes, They talk about how people they think and how we they look at development. So the whole idea of mental health and why make we capitalize on for talk about them and for see how we go change people their mindset about how we bring them the work and how we they look at our country.
All right, now look at this. We demand them. Most of them now they sleep, because of this KUSH, And some way meet them, then they tell you, say, they get plenty to with the think. So the only way no more for resolve that now for like taking KUSH and sleep. But that again, they affect in mental health.
Mm-hmm. Yeah, so if you look at the theme we'll get this year, like we talk about mental health. Now, but the prevalence of drug abuse in a salon, and most of the time you meet possibly they use drugs, you always get justification. You go tell you say, oh, I don't get work, and I take drugs, or I get stress, or I get waiting the money. And because we don't get the platform for welcome people and for talk about waiting they run at their mind, they always look at this easy option for say, I take drugs, I take the drugs at least for a certain period, I know they think about me problem there. So we they try for raise awareness for we know say we need for talk to the youth and make them aware say even though then they face some certain problems them, it better for you talk about that than for go take drugs we be say go unbug you and you go unbug the community who say you did.
So how for manage them people in day? Because what in they think if you to say we sleep, they forget the problem, but they forget say get for week and they continue with the problem, So how for manage that, so that at least we go, reduce this drug abuse, in this country.
Yeah, so the first step that for talk about the drugs, the issue of how the drugs they affect person. Because most of the time where you see how people in the start for go inside drugs, if they take them, if they feel saying for that moment no more, it they satisfy them. But most of them drugs they are all they see, nothing they way addictive, where be say it they used to your blood. Like how they can talk about Creole. And time go reach, you go one left, but you know they go for left. Because now your system don't used to these particular drugs and it demand for her. It wants her, even though you mentally you want for left arm. So we focus on we get workshop we already don't do what would they go out to the youth them and explain to them but them particular drugs they are so how them bad for them, how then they affect them mentally and how it go reduce them value in society. So we also try for communicators what they call harm reduction. We are in the government, they take this issue with two hands and look at how they will reduce the incidence of these drugs, how then they regulate them, how they will ensure say people they know say this is a bad thing and we're not supposed to be involved with society. So we look at for advocates to government for how its policies them where they regulate the kind of medicine there, where they can our country, but also at the same time look at the people the way they take the drugs as mortal man. Because most of the time we see person don't begin to take drugs, so they push common around. I not talk to this person as na junkie. I talk to this person and person they take drugs. Not realizing that at a certain point, this will be healthy person will be the function of society just like how you be the function. But at some certain period, you don't begin for take something. We don't begin and bug in mental health. So we look at how they go focus on harm reduction and ensure that they monitor the people the way they take the drugs and also the one the way they sell them. Because most of the time you go into the communities, it's very obvious about who that they sell the drugs. But who that they can regulate, who that they can hold them people there. Like I will give example, like the community where they we get this particular space when I did the young man and they go smoke. People in Canada, they grumble no more, nobody not get mind for go meet the person where actually they sell the drugs. So I come with some of other community members, we go meet the woman. We say this you drugs where they carry it because we get some youth them as young as 13, 12. They don't begin indulge in this KUSH business here. And we go meet the post where they sell and say, come on our community. Because this car we don't kind of our community now it don't begin for cause this harm to the youth them. Because if you talk to most youth, the reason why they go into this so to say now they want for do them. But they feel like this is the easy solution. We go make us stop for think too much about my problems there. And la do no more. They tell we ready for left, I go left. But like I say, where it not become addiction, they part of the system. So at the end of the day, they're not going for left them bad in their asshole. So we look at how we foster the conversation with community. Look, not showing people the way they take drugs, and at the same time tell government for them make more stringent policy on how for regulate the drugs the way people then they take.
Why they talk? You say when I tell the woman, now woman be they sell the drug go na go meet in a community.
Yes. So the woman know they live in our community. If they come for can sell. They go. Like we don't sell say it go. So we go and target the particular space inside they go because like I say we community where they we be get picking and as young as 12 and 13 when then they go buy the drugs to the woman. The woman know they even limit for say okay you know a small pick and they sell you. Your whole interest was I just want to make money.
So when I'm in the Gaba now a community go?
Yeah, end up for go because we tell and say we go report you and we go take legal action against you.
To the security personnel instead.
This not like I say we don't try for do all lensing and I don't want for be harsh on securities and the people who are supposed to regulate. But if you go into a community, like I say, the people where they sell drugs now, they know they hide. If you come, you ask even small people for say, oh, show me this person where they sell, I want this thing here. Then they take you and then go with you in the space exactly outside they know say that they sell the drugs.
Why they talk about Office of National Security? You say no one be ash, but they shake it like an agree. So what do I inside the conversation? Because it's not like not the reality. They talk, but because in the Apple community, they see people and they go get an appointee. They don't say something and they do exactly that particular place.
You know, in fact, one thing where they see David. You go see society, see the Okada Maya, so say them back the Boku, you know, you say they can't pack Boku. You don't wonder what in them are they can pack here for. You understand? Apart from the junction everything can do. You understand? We also say something on the day around that place there. Where the leak, you know. So now that the hotspots where police for target, you know.
And we look at and the main reason why make people not can go do something like what we do so because mindset of shunning people the way they take drugs most of the time. So when you watch, like for example, you can at the community, you go see say the well-to-do people, or the people the way go able to forget the voice for communicate the message. They no one mix with people who take drugs. That they own mindsets and they don't lucky youth them. On a youth say we no one better thing and make them they do them thing they are so. They then go fair and walk. Okay, most of the time are the mindsets and then the way we can get. So we they fail for go directly and talk to the people them way at the end of the solution that they own any day. Because if they stop for buy drugs, for example, drugs not go sell. But how they will become aware of the harm we already they happen to them. And that's the big issue.
All right, plenty thank you, Umu. Well, yes, what you make of the text message, the round of the program.
Yeah, thank you very much. Basically, Mr. Nabe don't answer most of the things that we need for be said. So, like, the kind way we get awareness about mental health, it's important for the whole country get the same awareness. Like I say, mental health no means we get mental health issues, no means you get for going on street to go pull close. At one time, they will talk and say, Dr. Naim talk say 90% of Sierra Leonean increase. They make us fun with the laugh. But basically, the basis of that time, they tell you say people then get things the way they battle, things the way they go through their mind, and they will only be aware of what's in one of them where the open discussion day. And the major platform or the major first step is government, prioritizing mental health. We will talk about health development because some sickness and the way some people then they get. Where they affect how they reason, they lead to even where they go take drugs, they lead to this crime and violence. They get all the different way the way they affect how we community they develop and how we're able to sustain their development there. So the whole idea is mental health is important and mental health is key to development.
Okay, thank you so much, Umu Jalloh from the Sierra Leone Association of Social Workers. They said they talk on this drug abuse in the country.